Battling birth outcomes and disparities in our community. As I found out, professionals in prenatal, birth, and postpartum care are now working on ways to lower mortality and poor fetal outcomes.
It's a part of my calling.
Harisha Thompson knew who she wanted to become.
Becoming a doula was something that was extremely important, but not feasible at the time because we're working, right?
A nurse by trade with hopes of becoming a doula as well.
I know without a shadow of a doubt that I can help people who are not being helped right now.
Her passion stems from a deep place, one that Ruth Kraft,
I've been a doula for 20 years now.
recognized. She gave Thompson a scholarship to become a doula.
I wanted people from the community in it.
Through her nonprofit Community Calling.
We did 20 scholarships last year with the goal of reducing the maternal and infant mortality rate, especially in the people of color communities.
Funding training to become doulas.
It's pretty clear that it's mostly been white women in this profession.
And then pay them to work in underserved communities.
It's also the cultural sensitivity part of it. I know what your grandma said, and what our grandma's said about, different things on what to do when the baby comes and how to take care of yourself and what tea to drink.
If we had more of a diverse doula population, the people who are then seeking out those services would be able to relate more to those doulas.
It's an effort to change disparities in birth outcomes.
It's not just, hey, it was great to have someone who rubbed your back during labor, right? We have really good outcomes with doulas and just in general.
According to the CDC, black women are more than 3 times as likely than white women to die from pregnancy-related causes, and black mothers are more than twice as likely to experience stillbirth compared to white or Hispanic mothers. Dr. Ruel Stossel specializes in high-risk pregnancy. He works with the T. Leroy Jefferson Medical Society, a group of healthcare professionals focused on underserved communities.
What makes a difference is by having top-level providers that are driven by empathy, that recognize the patient as a person and not a disease or number.
Driven to create change, stressing the need for quality prenatal and postpartum care, opening family-centered offices in St. Lucie County, Lake Worth, Belglade, and other areas.
Other staff members that want to be out there.
Reaching more women to make a difference.
All the various ills that we've seen over the years, we have culled that down, such as premature birth, the number of C-sections that are being performed on patients, the complication rate for delivery and postpartum, and of course maternal mortality.
Doulas and doctors working in their own ways to hit cultural barriers.
I know this is a systemic problem, but I know that me doing my part as a doula to serve these communities will definitely move the barometer a little bit, right? And that's all we can do. If each person is steady moving that barometer, then the change will happen.